Welcome back. My last video was about how it finally happened again. Found out I was pregnant 3 weeks, 6 days. I ended up having another miscarriage. So this is my second miscarriage in 7 months. What I want to go through today is the actual procedure I had to go through because I didn't know what to expect. And it was a lot more than what I thought it was. I just want to kind of walk through it. That way, if somebody is going to have to go through this, they know what to expect. And it's not as much of a blindside as mine was. The first thing is, try not to cry on camera. Found out I was pregnant at 3 weeks, 6 days. HCG wasn't rising very well. At about 6 weeks, I went in. I was already told it could go either way. At 6 weeks, they saw a sac with a little, what they call it, yolk sac in there. So got my hopes up, but then they told me my HCG wasn't rising enough. So I had to go about 7 days, not knowing if something was happening in me or if I was going to miscarry. At 7 weeks, my HCG was starting to drop and they wanted to do the procedure because the sac wasn't enough proof that it was there. They thought it might be ectopic in a different location. So I had to do a procedure because it wasn't viable and because they needed to make sure that they found it in the uterus to make sure that I didn't need to go on a medication because it was ectopic somewhere. So that's a very small summary of it. The procedure that I had to do was called an MUA. I'm not remembering the correct words for it, so I'm just going to go ahead and put it right here. Right here. I went in. It was a Saturday morning. I had to be there an hour before even going into that procedure. I had to be NPO for at least 6 hours. So clear liquids only and no food for 6 hours prior to the procedure, probably because of all the meds I was going to be on. I opted to take my sister because she's just amazing and calming and funny and understands what a menstrual cramp is. My husband's fantastic, but I wanted female energy with me. So I arrived, checked in. They brought me to a pre-op room where I had to change into a hospital gown. I was allowed to wear my bra, which was fantastic. I don't know why, it just made me feel a little bit more in control. And the gown tied in the back, couldn't wear anything underneath, obviously. I opted, there was 3 different options. You could do oral meds, you could do IV meds, or you can go under general anesthesia. I opted for the middle ground because I know I could have got through it with just the oral meds, but I'd already been through a lot emotionally with this, being my second loss, that I didn't want to feel it. I wanted the anxiety down, but I didn't want to go all the way out under anesthesia. That just seemed like a little bit too much for me personally. I was sitting in there with my sister and a doctor came in and consented me. So went through the different risks, very minimal risks, and just made sure, walked me through all that. Had to sign paperwork on it. Got the wristband, got an allergy band because I'm allergic to bees. Not that they're going to be pushing bee venom through me, but that happened. So I was sitting there, sock covers on and a bonnet. So the nurse was very kind. She had me take Ativan orally. So she gave me 2 pills for Ativan because it was about 30 minutes before my procedure. She gave me Tylenol. I think it was about 1,000 of Tylenol, and that was also orally. She did that. Once that was done, she started an IV on me. With the IV, she had a big bag of saline just running a drip to make sure I had that going. With the IV, she said that she was giving me Zofran to help with the nausea because of all the meds and such. I was going to be pretty nauseous. Then what else did she give me? There's another very cute little med bottle in there, but she gave me, I'm not sure what it was, honestly, but she gave me something else. At this point, I was calm. So I didn't really care what was happening. For the pain, it was fentanyl. So once I was in the procedure room itself was when the fentanyl took place, but I'll get into that in a moment. When it was time, they just brought me over, and the room, even though I'm used to this, I'm in the medical field, I just wasn't prepared for the room because it was very dark and I had to get up on the table and they had a chucks down just in case, obviously, with the bleeding and such. The doctor was really wonderful and nice and walked through the whole thing. So you scoot all the way down. It's interesting because your knees are actually hanging over. Your knees are like in the stirrups, right? So you're not like your heels aren't in them like you're used to at the gynecologist and for all the ultrasounds, but your knees are kind of hanging in the little stirrups there. So got the knees comfortable. I had 2 nurses in there with me and the doctor. the doctor, for him, he didn't like to go off of ultrasounds, even though it was a day prior. He liked to do his own. So he said he was saying everything he was doing. And then I had a nurse on my left-hand side who was distracting me through things by just kind of tapping my shoulder. So he said he was going to begin. He went ahead and did the vaginal ultrasound so that he could see the tissue and see exactly what he was working on. That was totally fine and what was expected. And then the difficult part was, I'm pretty sure they said at this point I was on kind of a decent amount of drugs. So if any of this is incorrect, I'm sorry. But my understanding was they had to go in and do different shots in the area. So I felt like a really long, I want to say needle, but I'm just going to say probe. And right before then, he told the nurse, okay, give the fentanyl. So she did the fentanyl for me, kicks in very, very quickly. And I did feel it. I felt it on my right side first. It was uncomfortable, but not unbearable because of that pain blocker. And then I felt it on my left side next. And the nurse she's just watching me, making sure I'm okay. She's trying to distract me by just tapping my shoulder. They had me on oxygen with a nasal cannula. They had me on monitoring. I was on a pulse ox for my oxygen. And then they did have leads on my chest to make sure I was fully monitored because of the narcotics that were going in my system. Then he began the procedure. It was very short. Like the amount of time was very, very short, which I'm very thankful for. But it's when he goes in and he pulls out the tissue. I think he only had to do 2 sweeps, to be honest. It wasn't very much. But at that point, the reason why they gave that fentanyl right then was because the uterus started to go crazy. So I started to have like cramping and I was scared that it was going to get worse. So I told my nurse, she's like asking me how I'm feeling. And I said, okay, there's some cramping. I'm feeling the cramping. And she said, okay, out of like up to 10, how bad is it? And it was just a 5. So didn't actually need an additional dose of fentanyl, but I did feel it happening. So that was the hard part about the procedure. It was the room was just intimidating because it's dark with that big surgical light. It feels very invasive. Obviously, you're very vulnerable. This is something that you wanted to happen, that they're having to test to make sure that you're safe, honestly, because they weren't sure where mine was. And I was hearing the tools, and it's not very comfortable, even though I was on the calming meds and even though I was on painkillers, you're still hearing the tools. They're still having to dilate your cervix and you hear things happening. At least I did. Nothing extreme, and they were all wonderful, but that was more than what I bargained for. Like I said, it was over pretty quick, and I hesitate to say it wasn't too bad because I want to acknowledge that it's a bit traumatic, even if you're semi-mentally prepared, like I feel like I wasn't apparently. It was just more involved than what I thought. I don't know why I thought it would be any different. They're going in and they're cleaning out your uterus with something that you hoped was there. I don't know why I didn't think it would be a lot, but anyway. So once I got done, the nurse helped me up, helped me into a wheelchair, and wheeled me back to the room. My sister was waiting for me. I was able to get up. I got on another Chucks because I was going to be bleeding a bit. She made sure my gown was pulled back. That way I didn't get any blood on my gown. And I had to stay there and recover with an antibiotic. It was about this big. I can't really show you a measurement there. And I had to wait until that bag, it was a one-time antibiotic drip. So I had that saline bag that was still running through my IV and that antibiotic drip that was running through. And that was my post-op care. She gave me ginger ale and saltine crackers, which apparently when I'm on all the painkillers and anti-anxiety meds, I'm like really big on selling ginger ale. I was trying to convince my sister that it was the best thing I've ever had. She needed to get one for herself. It was amazing. And I was all about, I could have been a ginger ale spokesperson, man. So that was a little weird side note there, but hung out for a while. It took a while for that antibiotic to actually completely run through. And once I was done, they made sure they were checking my blood pressure and everything. I had that cuff on and it was a little bit lower from all the meds. My blood pressure had dropped a tiny bit. So that machine was alarming a little bit here and there. But for the most part after, it was just me snacking on saltines and drinking my ginger ginger ale with a little fuzzy foggy head of mine. Once that drip was done, I was actually okay to move slowly and walk out of there. I got in the car and we drove home, got some food at a diner, and I just fell asleep on the couch. Honestly, after all that, fell asleep on the couch. My post instructions were nothing in the vagina for 2 weeks, no submerging in a pool, anything like that, baths, because you have to be really careful about infection. So I was told to just keep an eye on it. Very, very rare and not common to get an infection, but I was supposed to just monitor myself. I'm only 4 days post now, so continuing to monitor myself, make sure that I'm not having excessive bleeding, make sure I'm not having excessive cramping that can't be managed with pain meds, and just watching for a fever and such, kind of your standard routine. What surprised me was I didn't have any pain. I thought for sure I would have a ton of pain post because, I mean, my cervix had to be dilated. I thought for sure I'd be sore or something. Zero pain. I had a really good doctor, so that might be why. And for me, this is different for each individual woman. I barely had any bleeding. On like one pad, maybe a tablespoon of like that brownish discharge the first day, but I haven't had any spotting or bleeding. It's been kind of surprising. I thought for sure I would have pain and a good amount of bleeding. I didn't think that I'd be over here like no pain, minimal cramping, and no bleeding. It's just kind of surprising to me, and I'll take it. Don't get me wrong, I will take it. And the other thing I had to do after all this was I had to get my HCG tested the following morning to make sure that it dropped by at least 50%. If it didn't drop 50%, I would have to go on a medication to kill the ectopic pregnancy of an unknown location. So that night I went to bed, and it was a horrible night because they told me that from the Zofran and such, I was going to be constipated and to take a laxative. I did a tea around 3 p.m. It was a tea that I've used in the past because it usually just takes me 6 hours for it to actually kick in and work. It decided to kick in at 3 a.m. So I was on the toilet in pain, just suffering till 6:30 a.m. every 30 minutes. My gut was just getting rid of all the meds. It was freaking awful. I had 3 hours of sleep after this procedure. And then I had to drive back with my husband and get my HCG pulled again to see if I was going to have to go on a hard med or not. Now, the good news is it dropped from like 1050 to like 300 in 24 hours. So I'm over here having this huge, fast drop of hormones while I'm also stopping progesterone. So it was just this intense hormone drop in such a short amount of time. My body's exhausted. My hormones are just tanking. And I'm over here like, I don't even know how I'm going to cope with this. It's just unfreaking believable. So there was that. I have had a lot of crying. I actually just got off a session with my therapist. It hits randomly where I will just feel like this wave of sadness and these hits of depression. But then I'm thankful that I had the procedure and I didn't have to bleed for 2 weeks and pass everything naturally and be reminded every time I use the restroom of something falling out of me with heavy clots and such. So I'm actually thankful that I almost got to fast forward that part and just go into recovery without a constant reminder of what could have been. So that's really nice. But it just sucks. It just sucks. And I'm trying not to let it mess with my head because I'm telling myself like this does happen. And I'll talk to my doctor. They're probably going to do a workup for me to see what's going on if there is anything, because I did choose to have kids. Well, try to have kids over the age of 35. I knew what I was doing. It's not uncommon to run into stuff like this. It's a lot to handle. Your emotions you're just all over the place. I'm trying to let myself feel them without going into a bunch of unhealthy patterns. Like I'm trying to give myself grace here and there, like have a glass of wine with my husband and watch a great show, maybe have a little bit extra dessert, but stay healthy, hydrated, vegetables so that my body can heal and that I don't feel awful. And this is pretty discouraging. And I don't even know how I'm going to be excited next time I get a positive, because now all I've seen is it fail twice. Recurrent miscarriage. And in the stats that you look up online, it's like 1 in 100. So now I'm going, oh, great. This is not the stat I wanted. Yeah, my heart goes out to anyone going through something like this, especially if it's further along. Again, this happened at 7 weeks for me. If you've lost your pregnancy later, I'm so sorry. So yeah, that's my update. If you have any advice on how to take care of yourself after this and how long you waited before you were ready to try again, you can leave it in the comments for me. I appreciate anything right now. So you can tell I'm very monotone and still pretty numb. I'm gonna give myself 20 minutes every day with a timer to just feel and cry and let it out and just grieve. And I'm taking time off of work right now so that I can do that as well, so that I'm not working my job taking care of other people at the moment. I'm just trying to take care of myself. It's just sad. It's just sad. So yeah. And like my therapist told me today, all my feelings are valid. And just because there's somebody out there that has it worse than you, there's always going to be somebody that has a harder story, worse, more losses. Doesn't mean that what I'm going through is minimized. So yeah, this wasn't fun to do, but let's not be fake, because the last one has a positive pregnancy test. That's it. That is my procedure update, kind of what to expect. That way, if you're going into something like this, you have a general idea. Bring a good support system of just whoever makes you feel the calmest or is funny, whatever you need, bring that person. Enjoy your day. I'm going to take 20 minutes and cry now. Thanks.